Have you ever been victimized by New Age spirituality?
We've been waiting for you. We've been waiting.
You're gonna want to listen up.
I'm Megan, an intuitive life coach and Reiki master.
I'm Ryan, a professional astrologer, and we want to show you what spirituality is by talking about what it is not.
Con artist.
Yes.
Snake oil salesman.
There are so many susceptible people out there.
And then they're tainted. They're ruined. They don't want to come back to spirituality.
We still have a lot to learn, and we will humble ourselves and learn, I think, every freaking day. This is Clairannoyance,
a podcast of spiritual interference.
Drugs! That's sort of a theme for today.
Well, it's funny because, you know, as a former party girl, what we're going to be talking about is I was introduced to it as Special K. So in Special K, I saw a girl one time at the strip club and she had to be carried off the stage because all she did was she was pointing at the DJ, yelling. And that was my only, and Special K, ketamine, it was like we were told growing up, it was like a horse tranquilizer or something. And she was frozen on the stage pointing. And she had to be she had to literally be picked up by her armpits and carried out. And so at that point, I was like, I'm never messing with that.
Dude.
That's going to be a no for me, but I want control of my limbs because she was like frozen. And but that's what we were told. But that was my lasting impression of this until it started to, ketamine came about. We're not calling it Special K. Obviously, what that girl was on was illegal drugs. Still kind of called
that, though. People in LA still call it that, yeah.
Really?
Yeah.
But then all of a sudden, I remember one of my friends she's got multiple mental health diagnoses, and she got on TikTok and started crediting ketamine as saving her life. And that's what got my attention, because I'm like, if this girl who has had 20 years of relapses has not been able to have a normal life, normal job, a wonderful person, if she is crediting ketamine, that's when I started looking into it, and holy cow, what an amazing journey. So that's what we're here to talk about today. What about you? What were your thoughts before ketamine came onto this?
I have a high tolerance, and I can't tell you. I did ketamine so many times recreationally.
I've never done it.
And never felt a damn thing from it, honestly. But this is normal for me. I'll take a Vicodin and be like, what's the point? Honestly. And then I had a friend give it to me, and I'm not super well versed in this. But I've heard there's kind of an upper and a downer version. We'll maybe ask about that. And then I took one. I don't know, that's the wrong way to even phrase that. Did it once with another friend of mine who is a homie, and really trust him. I'm very picky with who am I gonna do this with, And oh my God, this one night was just out of my mind. We were walking through this bar, and I was all of a sudden I'm how am I even walking right now? It was a great experience because I was oh, it's been a while since I've had a different mind altering experience than anything else I've ever done. But it was the first time where I truly felt oh, okay, ketamine's hitting today for some reason, but it never hit prior to that. I never understood it. So obviously this is not in a therapeutic environment, and this is not recommended.
Yes, what we're talking about, we're talking to a trained professional. And why? But I think it's important distinctions to make, because it went from being a party drug. At least that's how most people were introduced
very much.
to.
I've seen people out of their minds on ketamine at
and
parties.
Now it's this incredible experience. So we have a trained professional, a medical doctor, but also with a spiritual background, who actually we were connected by your dear cousin. Shauna is just out here making the connections. Hey, Shauna. But,
spiritual concierge, Shauna.
I know.
Spiritual concierge, girl.
Dr. Dan, please introduce yourself. What's your deal? Who are you? How'd you get here? And let's get into the very interesting treatments that you do, because you're an interesting guy. So we want to get into it.
Thank you so much. I am super Psyched. I've been looking forward to being on your podcast. I love listening to it. I love the authenticity that you guys bring. It's just so refreshing, and been really, really, really looking forward to this. So, yeah, my name's Dan Ripley. I'm a family medicine doctor by training, board certified in family medicine. But about a year ago, opened up a clinic here in Charleston, doing ketamine therapy, and it's sort of a long, interesting road to get here. um, that took many turns and had many synchronicities in it, but I'm just so grateful to be in this line of work, doing finally what I feel is my soul's purpose in being here on this planet, helping people get over their depression, anxiety, and really getting to the core of what's causing that, which is, the traumas that we all endure in our lifetime. So that's um, that's who I am.
Cool. So, what is ketamine? First off, like,
Yeah.
what is this?
Ketamine is so interesting. It came about in the late '60s as a an anesthetic on the battlefields of Vietnam, and so it was developed in a lab. It at high enough doses will anesthetize you. It's a dissociative anesthetic, so it takes you out of your body and allows us to
Mhm.
to do painful things to it without you feeling the pain.
Mm.
And it doesn't require you to be intubated or put on a machine and breathe. It's very safe, and extremely effective. So it was used in the battlefields of Vietnam because you needed something quick acting and that didn't require um, a breathing tube and all that stuff. And so it was very effective there. And in the early '70s, the veterinarians said, "Hey, this is a really safe, effective drug in humans, and you don't have to intubate your patient." And when they don't like to do that to their four-legged patients, and so I was adopted by the veterinarians, and that's where it gets the misnomer of being a horse tranquilizer.
Mm.
It's a horse anesthetic. And then it was adopted by emergency rooms and anesthesiologists in hospitals. So it's really been used for 50 years in hospitals, veterinary offices. But really, in the last 20 years is when the research started happening with sub anesthetic doses. So you're not completely anesthetized and you're still aware and having these incredible journeys to treat depression, anxiety, and PTSD, and mental health disorders. And it was really, I mean, it's been 20 years since that information has been out.
Mm.
But
Yeah.
really, in the last 5 years is when it's taken off, and these ketamine clinics are opening up, and home ketamine therapy and all that stuff. So the
Yeah.
renaissance of psychedelics kind of brought about ketamine to the mainstream because it's the only one that's legal right now.
Yeah, that's so interesting because I like the conversation about legalizing psychoactive substances for this use. Like, I mean, the psilocybin, MDMA, like I that's been in the news like constantly forever. I feel like the ketamine thing came to the forefront out of nowhere. Like it was just like, who thought that was just gonna like topple the
That's
other
so
ones?
true.
Like it's so bizarre to me. So I'm just really interested in how this got traction, I guess. Like really cool.
The real reason is because ketamine is used for other purposes for anesthesia that it's
Mm.
legalized. It's a scheduled drug, but it's a Schedule 3, so it's not highly addictive. In fact, we use it to treat addiction. But because it had other medical uses, it was legal, and that's why it's the only one that's legal right now. But psilocybin and MDMA are coming real soon. We got a lot of data, and
Definitely in California. Dr. Dan and I are in South Carolina, so so it might be. So that makes sense why a lateral move. If it was already in
Yeah.
medicine, then that's why we didn't have to go through the hoops that this some beautiful but sometimes backward state implies. What initially drew you to like ketamine and like as like so you went from family doctor and also you have an aesthetics practice, medical aesthetics. And so you went from family medicine to aesthetics to then blending both of them. Like it's a very interesting. I'm curious how you got here.
Yeah. So I was using ketamine in my aesthetics practice for the painful procedures, laser and microneedling and things like that. And it was wild because we were using this for anesthesia and doing these procedures on people's faces, and then they'd come out of it and we're like, I had the most incredible mystical spiritual experience. I'm like, I'm just trying to staple your face. It was really wild to hear the stories, and very, really cool and fascinating. But I never really put it all together. So that was my initial experience with ketamine, just as anesthesia. And then my family um, was struck with a tragedy. My oldest brother died of a brain tumor, glioblastoma,
Oh,
Mm.
I'm
and
sorry.
it really threw my other brother for a loop. And he went into a really serious bout of depression. Medications weren't working, therapy wasn't working, hospitalizations weren't working, and he was really, really in trouble.
Gosh.
And he found, started doing some research. He's kind of alternative medicine kind of guy, and so he started doing some research and found out about ketamine. And he actually connected with a guy here in Charleston who does home. He's in San Diego,
Hmm.
and I found a guy here in Charleston that does home ketamine therapy, and he started using it, and it changed his life. It really was the only thing that turned him around and literally saved his life. And so he reached out to me. He's like, "Bro, you've got to look into this. This stuff is amazing." And he went into depth about how it helped him. And so yeah, so then I started looking into it, and I was looking to make a shift as well. When I lost my older brother, I realized that I was working too hard, and I was on call 24/7, and I was killing myself for what, and so I was
Yeah.
looking for some way to slow down a little bit, be able to take a little more time for myself, and still help people. And so I looked into ketamine treatments, and I went down to the Ketamine Research Institute in Tampa, Florida, and learned how to do it the proper way. And
Not a backwards, not a
yeah,
backyard
Not a
establishment.
I mean, it's crazy, guys. If you have a scheduled license, you can open up a ketamine clinic. You can have zero training. You can be a gynecologist and go out and open up a ketamine clinic without
so
any,
wild.
without
Wow.
anything. Yeah. So I knew if I was going to do it, I wanted to do it right. And
Right.
yeah, so that's why I did the training for it. But and then just kind of sold my practice and jumped out of the plane and hoped the parachute opened, and it's all worked out beautifully.
Whoa. So in the process, I mean, so would you consider yourself side note before, like, was that your spiritual awakening, so to speak? That catalyst, were you spiritual before this or kind of curious? Because you have a brother who, your brother is into some alternative stuff. So I'm sure that you were, but then you have a medical background. So,
Hmm.
I mean, how did that
Science.
come about? Yeah.
Yeah. No, that I've only done one ketamine treatment. That was during the training, and it was incredible. It was one of the most spiritual moments um, of my life. But my awakening actually came probably 5 years prior to that, when that same brother who had the depression he also had cancer. He had head and neck
Mm.
cancer.
Oh my
He was
gosh.
interested in alternative forms of healing then as well, and he went down to a place in Costa Rica called Rhythmia Life Advancement
Oh
Center. That's
yeah.
heard of that. So,
Ayahuasca.
Hmm.
so the mother vine
Yeah.
spoke to him, and really incredible, but probably too long of a story to tell here. But he found the energetic and the emotional tie to his cancer, and he healed that with ayahuasca, and his tumors
Oh
started to.
my goodness. How cool
See,
is
this
how are
is
you
the
gonna say that so
thing.
casually?
This is no, and that's so not casual. Yeah, that's like
I
an
mean,
amazing,
that's
amazing.
insane.
Yeah,
Side note,
and
I
it's
just got a text 2 days ago, Dr. Dan. I know someone who's going on an excursion with you to Rhythmia, so I'll tell you.
okay. Yeah,
Oh my
They saw
God.
your post. They said on about being on the podcast, and they sent me a text. They're like, "Dude, that's my friend. We're going together." And I was like, "What?" So, just such a small world. How everything keeps getting looped back in.
So that just, that opened my eyes, being trained in Western medicine and being sort of blinders on in the Western medical um, paradigm. And then to see him cure stage 4 cancer by healing an emotional wound that dated 50 years
This
ago.
That's
this is shit
insanely
science can't
amazing.
explain. Like this is so important. These stories are so fucking important. I want to shove this in the face of like every scientist I know.
Stage 4 head and neck cancer. I mean, that's a miracle. I mean,
Literally.
truly. That's incredible.
In his lungs and his lymph nodes. It was everywhere. I was scared for him actually. Um, but
With your medical background, were you like, okay, I have to prepare for, yeah, this is, you're drinking some whack Kool-Aid, buddy. Like I got to prepare now to lose my, I mean, that's what you would, the logical brain is thinking like, okay, I respect your decision, but
my
this
first
is,
response was to get him into the head of head and neck cancer at Sloan Kettering in New York, and we did. He had a consult with them, and they said they could, help him with radiation and chemotherapy, but he probably wouldn't eat again. He probably wouldn't talk again because of where it was
Man.
and the amount of radiation. He was like, "Sorry, bro, I'm not signing up for that."
Yeah.
And
yeah.
I
Oh,
respected his journey, but I didn't know much about it.
Mm.
Uh, and then I got an education.
Wow.
isn't it
uh,
so wild that the perceived worst things in life, the way it can just the complete course reversals of your personal life, like what you think is, I mean, because this is terrible. Your brother having cancer, my God. And then all of a sudden it's like plot twist.
mhm.
Yeah.
And I'm gonna, hey, not only me, Dr. Dan, needs a whole course reversal. And then you were brave enough to lean into it, which is not easy with a science background, with a medical background.
Yeah, yep.
But it makes you
But
so much more legit. Like honestly, when you have that background and then you move into a more spiritual space and this understanding of things science can't always explain, it's God, like what you're then capable of actually pulling off in life is going to be so much greater.
yeah, every study ever done, if it's going to have any weight in the science community, has to have a placebo arm, right?
Hmm.
And we put it in a little box and we call it placebo, and it's about, has about 30 to 40% of the effect of the actual quote unquote actual treatment that we're doing. And science just completely ignores this 40% of people that are getting better by taking a sugar pill and just calls it placebo and puts it in a little box. Why aren't we studying that? Why aren't we looking
Yeah.
into that, the human mind and what we're capable of doing, healing ourselves? I mean, it's just crazy to me to think that we just label it, put it away, and don't want to talk about it.
Yeah.
uh,
And 40%, that's a huge number. Like
Th-
that, these are huge numbers, stories,
yeah.
impact.
and it's physical things happen. You can lower cholesterol, you can lower blood pressure, you can reduce heart disease, you can do all these things without taking the actual active medication.
We've discussed this before. Placebo, which like I think everybody knows what a placebo is at this point, but it's true. You don't really think too much about it or put too much weight in it for some reason. I didn't until then we also heard about the nocebo effect, which is like the opposite and how you can manifest negative side effects, like knowing you're having a sugar pill, even like the brain is that powerful that you can basically make yourself sick
Hmm.
too. Like that's where it hit me very strongly. And I was like, all right, all right, all
There's
right.
a reason why positive people live longer, fuckers. Like, you know, like, yeah, there's a reason why people who laugh more. I mean, like, I'm just so glad that now it's not this hippy dippy thing. And now that there's legit science behind it. And so, we talked about, I mean, like, what exactly can ketamine be used for? Like, we said PTSD, depression, anxiety, addiction. That's so interesting. I mean, what can it be used for?
All those things that you just mentioned. It can also help with chronic pain, alcoholism, migraine headaches, neuropathies, painful nerve conditions. It's being studied in neurodegenerative disorders like Parkinson's and MS and Alzheimer's and those things because one of the things that ketamine does, it stimulates brain-derived neurotrophic factor. which is basically your brain's way of stimulating the growth of new neurons in the brain. So your brain is actually getting more neurons, you're getting smarter, you're getting,
Wow.
yes, not only establishes new neural pathways, new ways of your brain communicating with itself, but also growing actual new neurons in the brain, which is fascinating and amazing.
So you can get smarter by taking you can get smarter by it.
Contrary to all those commercials in the 80s that said this is your brain on drugs, your brain on ketamine is like
Shocker.
expanded.
We were we were lied to?
By the
uh,
government?
I'm
That's
dead.
that's incredible. I mean, all of those things, and I can't even, I mean, and if studies have just been, if it's only been around since the 60s, studies have really only been taking place in the past 20 or 30 years. I mean, we're scratching the surface on that because once it starts to get more funding, more studies will be able to take place. I'm gobsmacked by
Hmm.
by all of this.
we know kind of neurochemically what ketamine does to our brain and how it works that way. It increases dopamine and norepinephrine and serotonin, all those drugs that help us feel better. And it stimulates brain-derived neurotrophic factor. It hits 23 different sites in the brain, but we really don't know all the ways in which it works. And we are not at all taking into account the spiritual aspect of this and the experiences that these people are having. And the impact of that on their overall health is really fascinating. And I don't know how you're going to be able to quantify that, but to me, I think it's a big part of why this is so successful.
Well, that's why I had been, been curious about ketamine. And when we first met a few months ago, I was like, I've been looking for you. Like, I've been looking for someone like you who, who is open to the spiritual process of this because so many people it's weird and they want to have these experiences or they want to have a safe place for these traumas or they but in a clinical setting it can be very it can be tough. And so, I mean, he walked through the door for the sound bath I was doing, and I felt like I almost bum rushed him. I was like, oh my God, like a fangirl. I'm like, Dr. Dan, Dr. Dan, Dr. Dan, like me and you, we are gonna be friends. We have things to do together. So,
The feeling was mutual.
so I was literally, so my friend was like, calm down. I'm like, I will not. I am bummed. So what does the session look like? Side note, he has a giant golden retriever
Mhm.
with a heart on its paw that is in the session with you. So if that, first of all, that's how you could abduct me. It's like if you had a van filled with golden retrievers or just one, what's your puppy's name? Bo?
Oh, oh,
Yes.
yeah.
And Bo is in sessions if you want him to be, which sounds like heaven. A giant, lovable golden retriever. My God.
He's amazing, amazing. Yeah, so we do things a little bit differently here. We still want to make sure that our patients are safe medically to do this, and just about everybody is. There are a few medical conditions that you can't use ketamine in, uncontrolled hypertension and unstable heart disease. But as short of that, almost everybody can receive ketamine therapy. There are certain drugs that will block the effect of ketamine. And so when you're telling that story, I was wondering if maybe, I don't know,
Other things
uh,
were in my system, probably.
yeah, something was in your system that was
Probably.
blocking
Fuck.
the effect of ketamine.
Oh, yikes.
But short of that, so we do a real thorough physical on everybody and check labs and EKG and make sure that they're healthy and safe and ready to do the ketamine. We'll replace any vitamin deficiencies that might be um, adding to the problem as well. And then we schedule 6 infusions. So they're each 1 hour long infusions. They're done over the course of 2 to 3 weeks, those 6 sessions. And 80 to 90% of people have remission of their whatever their problem is, anxiety, depression, PTSD, um, in just 2 weeks. So it's extremely rapid acting and very, very effective. But we
That is incredible. Side note, you can't be like so cash 80%.
87% in studies, yeah. Yeah.
Wow.
What do you think
Uh,
are the instances where it doesn't work? I'm asking because I have like my best friend here. in LA has started taking ketamine therapy. And I was just talking to him last night in prep for this, and I was like, how has it been going for you? And he's like, mm.
Hmm.
And he's had a handful of sessions, and I guess they've told him like he might need a few more or something. But he's also been on like heavy antidepressants for a lot of his life, anxiety meds, like all sorts of other stuff. So I guess is there like when I was asking him, like, was there a question you would have or that you would think would be valuable or something? Like what he kind of thought of was is a history of like heavy drug use in his case, not recreational. Is it can that prohibit you and the effects of ketamine helping you or something? And I would say the same. I'm like, well, I've done like all sorts of things. Will a little dose of ketamine really do much for me at this point?
So in those percentages were done in the studies at Yale Medical School, and so they tested the real world ketamine therapy um, in some papers where they looked at the efficacy inside of ketamine clinics that are being operated outside of the ivory tower, and they
Mm,
found it not quite as effective. And
mm,
so that goes to, I think a couple of things. On our side, it goes to, is the dose tailored to the patient? Is it the right dose? Is it the appropriate dose? Is it the proper set and setting? Are people being put in a room and IV shoved in their arm, and the nurse walks out and monitors them from the next room? Or are they being guided? Are they setting intentions? Do they have integration afterwards to be able to process this stuff? So there's a lot of variables from our end of things, and that's where I really hope that there's some standardization and some things that are going to take place on our side where the ketamine treatments are more standardized across the board. And then you're right, the history of the patient itself. So, is this, do they have some really severe, longstanding, or complex trauma that stimulated all of this? Do they have chemical changes in the brain from substance abuse or, long-term medication use, or, so those things can impact the efficacy as well. But it's like peeling back layers of an onion whenever we do this emotional spiritual work. You're healing traumas, layer by layer, and sometimes it takes longer than 2 weeks or six infusions. So sometimes it's a longer journey for people, but I
Is the
truly
way
believe.
you do things differently that because that's what it was struck me is that you because the clinics here it's like a once a month infusion or some people have a nose spray and you do such a concentrated 2 to 3 week or 6 sessions 3 weeks and then you're also and I want you to talk about because you said nurses or the practitioners will leave the room aren't you in the room like like with them making sure that hey, are you comfortable? Wow, everyone knows I have boners over intentions, So like, so, like so you're setting the intention for them. You're not just like, hey, enjoy the ride, toodaloo. Like your nurse, your magical dog. It's you're creating a space, and I hadn't heard that. Before it was like, hey, go in once a month or go in, once a week or whatever, and you just come as long as you need to. That process of let's do this for 3 weeks, let's be intentional about it, let's be intense about it. That is very different than what I had heard from. So how did that go come about? What is your process? And is it like is your process something that you created? Is that the standard? Are people going rogue here? I'm super curious.
It's a little blend of both. So the Ketamine Research Institute, Dr. Jerry Glass, he was involved in all the studies in Yale back in the day. And so he has all this, data, and he's got 20 years of real world experience on getting the dose right. And there's something called Ketamine Plus is what we do here. And it takes into consideration the patient's ethnic background, their other medications, their vitamin levels, their genetics of how they process medications, their age, their height, their weight. So most ketamine clinics give you zero point 0.5 milligrams per kilogram because that's what was in the studies and that's what they use, and good luck. So we have a little way of just dialing it in, a little more personalized for each patient, so we get the dose right. And then the personal part is the set and setting. And so, having done a lot of emotional and spiritual work myself and my nurse as well, I think is really important in setting the energy in the space, setting the safe feeling so that because people aren't going to release and let go and surrender unless they feel safe and taken care of. And so that's why
Absolutely.
I'm in the room, Bo's in the room, Taylor's in the room, and we really want to be there for the patient because
Mhm.
sometimes, I mean, it's not often, but sometimes patients get in a space where they're in their journey and they're processing things, and it can be intense. And we're there to help them, do the breath work to get through it, to reassure them that this is okay, that they're healing what they're feeling, they're healing, and you can't do that if you're not in the room with the patient. And then the part afterwards, the integration part, is so important as well. Um,
Mm.
so I think we have a really beautiful space. I think we have the right combination of, the medical science and the spiritual science, and so our patients are able to release and let go and go really deep in their healing.
Will you
That's
explain
so
more about the
cool.
integration portion? I think that's something like a lot of people miss out on when it comes to any sort of like therapy like this.
Hmm. Yeah, so most people that come to see us, they're already in therapy. They've been with a therapist. Some may or may not be familiar with psychedelic therapy or ketamine therapy and the integration piece. But regardless of what the therapist is doing, it's going to work better after ketamine. So I never discourage anybody from firing their therapist if they're not, uh, into ketamine integration. But so we encourage them to stick with their own therapist, and then we also have a team they're not local, but they're available by telehealth. That's really experienced in ketamine integration, taking the lessons that you've learned in your ketamine journeys and applying them into your life. Doing things like breath work and meditation and staying in that space where you can really stay connected with yourself, which I think is one of the main reasons why this therapy is so effective, is because it allows us to reconnect on a very, very deep level. And to maintain that and keep it going, you have to have a practice. And that's where the integration specialist can help patients develop something that's right for them and that can help them continue their healing journey on their own.
That's so awesome. I mean, that's so cool.
Hmm.
And you have such great energy too. You could just, like you're kind, you're gentle, which I think when doing any sort of work like this, you need I mean you nailed it on the head. There has to be a safe space. If someone doesn't feel safe, then say that you have a deep rooted childhood trauma or any trauma at any point, the body keeps the score, and that's coming up. You're going to suppress that if you don't feel comfortable, if you don't feel safe. And you just have such a great energy to just your energy allows people to just be, like come as you are. I'm not going to judge you. And the gift. I mean, that's the mark of a healer, period, because otherwise, you're welcome. Otherwise, it's not going to happen.
I've always been a sort of calm in the storm kind of person. So I do think that's somewhat helpful. Bo is amazing. He's a healer in and of himself. He's gone through therapy training, and but he doesn't need it. He knows when somebody is really anxious or worked up, or when something's coming up, and he just will go and put his head on their lap and just instantly, make them feel more calm and at peace. And it's hard to be anxious when you've got a golden retriever in your lap.
Hmm.
uh,
And
and
he's
his
got this
energy.
giant, beautiful head. He's the most handsome good boy that you could. When he brought him in after the sound bath, I was like, "Oh my God, why? Like he should have been here the whole time." I mean, So if say you don't have any sort of like mental health issues, which is rare. I mean,
Rare. Who?
so, or say that you are just, like it's normal quote unquote anxiety, or it's just sometimes I get the sads, or could you still do ketamine?
Yeah, disclaimer. Ketamine has an indication for treatment-resistant depression and anxiety and
Um,
PTSD. So you have to have tried and failed,
yeah,
other drugs before ketamine is not considered a first-line therapy.
gotcha.
That being said, some people aren't candidates for traditional medications for whatever reason, or they've had some side effects or problems with that. So yeah, people think it has to be this war veteran with horrible trauma or victims of sexual abuse or whatever. But in reality, this medication it works on all forms of depression, anxiety, PTSD, complex, severe, or not. So um, according to the FDA, it should be a treatment resistant. But I believe in talking to the patient and honoring and respecting their decision whether they want to take these medications that are quote unquote standard of care, that, by the way, don't work for a third of the patient population,
Wow.
or have severe side effects.
Hmm.
And so, if a patient is informed, they know what the medications are that are available that are standard of care, and they don't want to take that risk of side effects. Um, then I honor and respect that, and as long as they're informed and know that this is an off-label use, doctors prescribe medications off-label every day in every clinic and
Hmm.
everywhere in the world. So
Can you speak more to like what you've noticed in clients, patients, patients as far as the spiritual effects? Like if they're going in to like heal a trauma, right? But they come out of it with some sort of spiritual epiphany. Like what is that like for you?
yeah, it's one of my favorite parts of doing this therapy is taking people, even some people that are not spiritual at all. I think it's hard to go through this experience and not come out
Hmm.
having some shift, um, some awakening of your spiritual self. And the reason I think, this is not scientifically proven, but the reason I think this medication works in that way is it's developed in a lab, right? So it's not a plant medicine. It doesn't have a spirit to it. What it does is dissociates us from our monkey mind and our ego and our anxiety and our fears and all of the things that aren't really our true essence, and
Hmm.
it takes those offline for a little bit and parks them in the corner and allows you to connect with your divine self, your soul, whatever it is, your life force. And to people, when they're in these journeys, a lot of times they'll say out loud, they're like, "Oh my God, I'm home. This place is familiar. I know this place." And it's really them reconnecting with themselves. And in that reconnection, that's where the magic happens. That's where the healing happens. That's where the spiritual and emotional and physical all come together. And it's incredible. People that come into it either agnostic or atheist, I think have a real hard time
Yeah.
dealing with like they just had this encounter and don't know how to you know put it all
Process
together.
it.
Process that. Yeah, like how do you deny at least agnostic? It's like, okay, I don't know, but there's some and I respect everyone, but I always get it like atheist. I'm like, so it's just like we're here and we're here now and then dirt, like that's like end of show. Like I
So many atheists, I think that they're really agnostic. I just think they're really agnostic. Like most of them, when you actually start talking to them, they start saying sentences that contradict atheism. So I'm like, okay, you're really agnostic. You're just not wanting to admit it. Like the ego brain is like, I'm atheist for sure. And it's so annoying. But whatever. Okay, so you're saying like there's this dissociative quality to it, right? Gets you out of the monkey mind. What if you're someone who's already in a dissociative state? Like that's your
ooh.
problem. Do you know what I mean? Like that happens, especially in the spiritual world. Like we're seeing people and just living in fantasy delusional la la land all the time. Is it oh if you're dissociating, can you take ketamine for that? Like
You can. They're really the only. I think that dissociation comes from these people that they just can't, or don't know how to deal with and process the trauma that they've experienced,
Mm,
Mm.
or the stress that they're under, and they just dissociate to not be um, feeling that, right?
Yeah.
So you don't want to give this drug to schizophrenics because it
Mm,
does increase dopamine, which is a main issue with people that have schizophrenia. So you don't want to do that. And you have to be careful in people who have manic depression because you're increasing their serotonin and you don't want to put them into a manic state.
ah,
Um, but yeah, so when you get to the point of healing those underlying traumas and those things that are stored in the subconscious that are making these people dissociate from their life, that will naturally would get better. Um,
I'm just
love.
like so fascinated by this. I could
Me
like
too.
it's so cool. I mean, to think that someone who, I mean, like I said, my friend Melissa, who it was just we loved her so much. It was like we just knew this. We didn't want it, but like the phone call is going to come. She constantly, chronic pain. Diagnosis. And she's very vocal about this, so I'm not disclosing her medical information, but she's got Hashimoto's and fibromyalgia and endometriosis. I'm losing vowels. And I mean, just like so many different physical issues. And then acute addiction and constantly has been to every rehab and literally everything. And to have this and she can live a semi-normal life and and be this beautiful hilarious person that she was meant to be, and now she's living on an incredible farm in the middle of the country with her boyfriend that they're creating. And it's just to see that level of healing. Do people, but she does the traditional, or I say traditional, but going once a month, or and then she says she can feel the effects wearing off. So I mean, I'm going to encourage her to, to try your protocol. Do people, so you do the 3 week session. Is there a maintenance after that? Do you need to come back in a 5 year period? Is there a touch up? What does that look like?
Yeah, so we see everybody at 1 month, um, and have a sit down with them and ask them how things are going, how they felt, and we have questionnaires that kind of gauge their levels of anxiety and depression scales that can give us a little more objective information. And then I found about half of our patients want to have a booster infusion at that point in time. And then it's highly variable. A lot of our veterans that had, severe war trauma, and that was the main underlying thing that was causing disruption in their life. Are able to heal that, and then we don't see them again. People that have prolonged depression, that have really struggled with this all of their life, that have deeper layers, need to come in once a quarter, twice a year, once a year. It's kind of highly variable from patient to patient, but uh, in I would say in most people the effects are not permanent,
Gotcha.
uh, but with the proper integration and all that, they can really go long periods of time in between their maintenance infusions or
It's
even
just like how
transition.
a salad won't, you're not going to be like have an 8 pack if you work out once and eat a salad, like
Yeah,
you have to use the tools to
Yeah,
get
but you don't need
you.
ketamine every day. You know what I
Yeah,
mean?
yeah,
Like,
yeah.
I think there's a difference here too. Like, and I'm curious about what you think implications might be in a long-term sense for healthcare as this sort of stuff becomes more popular and we're realizing, oh, in a few sessions, you can make something manageable and live your life in a much better way. Sure, maybe it's not permanent, like you'll come back every now and again for a booster or something, but you're not going to be on this pill that's once a day every day for the rest of your life. Like or I mean,
A
not
lot of
not to
clients,
hate
yeah.
on that sort of stuff, but like there are people who literally will do a therapy like this, and then, like you said, you don't see them again, and they've had like crazy trauma, and they probably have put it to a manageable enough point where they're happy and good enough to live their freaking lives. So essentially, what I'm saying is like, isn't it bad for business? It's like I think this all the time. Like, like
yeah,
it in a way it's bad for business, but I don't think in a short-term sense, because I think the more this picks up, the more customers you're gonna have, customers, clients, patients. You'll have it's such a different term in every field. But I don't know, in a long-term sense, it's like I'm just envisioning like a utopia basically where I'm like, people are just healed and then what? And
Yeah.
then what do we do?
Yeah. Yeah, it's certainly not big pharma's not super happy about
Yeah.
um so that's happening, an awakening that's happening. Um but yeah, I mean, there's no shortage of trauma in this world. There's no shortage of suffering.
Yeah.
And I think we could work as hard as we possibly could and get this to as many people as possible. And, we'd still be, never ending, right?
Hmm.
Mhm.
But the more people that we can help and the more people we can get off, and my ultimate goal is to get them off of dependence on these medications because they do have side effects. They do have issues and they have
Hmm.
cost. And so my ultimate goal is not to put pharmaceutical business out of business, but is to get these people off the medications and living a life that's more aligned with who they really are and what they're meant to be. And this we can obviously we can use ketamine and syndicate it in people that are on antidepressants. Um, Whereas some of the plant medicines and other psychedelics are dangerous to take when you're on an SSRI or whatever. And so these people can get off these medications using ketamine. And then if it's something that's in their path or their interest and they want to pursue more spiritual work with the entheogens, the plant medicines, then they're safe to do so. So
Wow.
my goal is to get people living their fullest, happiest, most joyful life off of medications and free to explore further.
How has this affected or your spirituality? I mean, because you're an instrument, you're a guide to this like deep healing within people. I mean, you can tell that you're filled with gratitude and, awe and amazement, which is like a pillar of any sort of spiritual practice. But yeah, how has this affected you personally?
Yeah, I mean it's definitely deepened and strengthened my spiritual body. And to be a witness to this healing every day is just it never gets old and it's mind blowing. I'm not I don't consider myself to be the healer. The patient is the healer. We all have the ability to heal from within. I'm just a facilitator and someone to hold space, to administer the medication and let the patient be their own healer. And that's really, really what it's about. But it's pretty cool to be a part of and to see every day. It's just, it's amazing. And yeah, I've had a lot of spiritual growth in the last 5 years since my brother's illness that sort of woke me up. Um, and just keeps getting better. There's always more work to do. So I'm here for it.
Are you seeing any like drastic, unexpected effects for people? Like I know there are people who have gone to like an ayahuasca retreat and come out of it being like, I need to quit my job and I'm gonna break up with my boyfriend and I'm gonna change my fucking life. Does ketamine have that drastic of an effect on people?
My depression's gone, and so is my loser
So
boyfriend. Get,
yeah,
get
uh,
Call me Bindi, and I'm moving to France. I mean, yeah, that's
literally it happens.
It does. It does. I think what's happening is people are getting reconnected with their authentic self, and
Mm.
they're no longer this person that they became because they had to in their to deal with their life or
Um,
their was. And so when you're authentic, man, sometimes the people that you attracted when you weren't authentic are no
yeah.
longer
Oh fuck.
meant to be in your life.
Damn it. Killing me. Ah. True. Testify.
So, but it happens
Ryan's
organically.
going through a personal metamorphosis right now, and
For
so
damn sure.
yeah,
Sober
so
too,
yeah,
believe it or
so
not.
so when you're going through it, it's like, oh man, so that
You spoke
that's
right to me. Damn it. Hey.
But it's the only way to live, man. Being authentic is the only way to be. That's when you really are living your life in a way and a purpose that is meant to be. Is when you're
Yep.
authentic. That's what I think all of these things are doing. It's just
Yeah.
helping us become ourselves.
Hard when I think society, and this I think is actually a difficult part of just like the spiritual journey in general, something that like a drug induced spiritual awakening can also bring to you, is I hate some of the language here, but like incels would put it as the whole like break out of the matrix vibe. But really it's more like you tap into that authenticity and you realize like who you are and what you want more. And then the hard part, I think, for so many people is realizing like, oh shit, like society is not set up for me to live that life. Like it's very hard to like break out of that box that you're like kind of shoved into in so many cases. And that I feel like that's like an issue with like the integration component of this, right? Like after you have this realization of who you are, or what you want, that like maybe like you got a gleaming pathway of where you want to be, but like it's very, very narrow pathway in this world. It's like we're just not set up for people to be living these like authentic lives, you know? I feel like that's like the hardest thing.
It is, and I think so many people struggle with that. So many people struggle with that coming out of these experiences in the jungle or wherever they're going, and then all of a sudden they're going to put the meat suit back on and go back to their job, and
Yeah.
it's like, oh man, but that's why it's a constant practice, and it takes work to do that.
I think we're in such a special space right now where like what you're doing is so important. There's clearly like shifting perception on all of this stuff. I think as more and more and more people are in integrating all of this, I guess, having these experiences, then I think the structures surrounding what we consider society to be can change and accommodate
Mm.
lives and people to be their authentic selves a little more. Hopefully, we can build economy
Yeah,
around that or something.
we're coming into the age of Aquarius, right?
Yes, we
So
are.
Hmm.
the age of Aquarius. So it's the world is shifting. And when I so I go down to Rhythmia once a year. I'm the doctor for the staff there, and so we do
You were
physical
the
Cool.
doctor. I
exams.
thought you were just going to like chill. That's even cooler. Sign
So
me up for next year.
I know, no,
yeah,
same, dude. I need to
Yes,
so
let
bad.
I will
So
get a
bad.
group down there ASAP. God, you learn me even more.
well, so last time I was there last June, there was probably 85 people there that week, and 20 of them were doctors.
Whoa, that was my
Which is
question next. Like, what do your
Wow.
colleagues think of this? Like, like, did you have blowback or like, what, because you have this science mindset. One of my best friends is an infectious disease doctor, and obviously, I'm an energy healer, and so different. We're different, and so she was like, "Hey, I don't know what the hell you do, but I know that I love you and that you make people happy, and that's all I care about." So I'm like, well, thanks. But, and that's, her stance. But from a medical side, like were your colleagues like Dr. Dan, fellow Dan, or I don't know how you, Dr. or fellow
Yeah.
Dan, Esquire, you've lost your marbles, bud. Like, what are you doing? You're selling your practice. You're like, don't, I have to imagine you hit some resistance with this.
Yeah, and I don't really care.
Okay. He said, I'm in
uh,
my authenticity.
yeah, that's it, baby. I'm sure people thought I was losing my mind. I'm sure there's still some people that think I've lost my mind, and I probably would have been one
First
of
of all, that
them.
was the best response ever.
If you had told me I was doing this 6 years ago, if you told me this is where I was going to be, I'd have said you're absolutely nuts. But yeah, everything happens the way it's supposed to. So yeah, people are always going to judge you, and people are always going to have
Hmm.
their opinions, and it says more about them than it does about me, really. And
Hmm.
I can't do anything about that. All I can do is um, what I was put on here on earth to do, which is to help people. And I did it for 25 years, helping their physical health. And now I've transitioned into helping their spiritual, emotional health, and doing the very best I can each and every day to make sure that my patients are safe and cared for, and that we're helping them. So
I think you're doing a hell of a job. I mean, I had, like I had heard about you long before, but not nobody. I mean, there's not a ill word, which in Charleston, which is, Southern gossip, they
I've
might,
only
they'll,
been here a year, so probably give a little time.
I mean, but nobody, I mean, it has been nothing but wonderful things. And I'm dead serious. Let's organize. Oh my God, Ryan, it could be like a clairvoyance
Retreat.
ayahuasca rhythmia retreat But then also, like where do you think the future of this is
Dude,
going? Do you think that people are good? Like, so, I do retreats. Obviously, like, not really, a spiritual retreat like that is not anywhere possible in South Carolina right now. But what what do you think the future is moving forward with this MDMA, mushrooms, ayahuasca? What does this look like?
I think it's all coming. There's enough data now, to be a Schedule One drug, which all of the ayahuasca, psilocybin, MDMA are Schedule One, which means they have no therapeutic medical use and they're highly addictive. And that does not apply to any of those drugs.
God, I know. Like, what the hell? If anybody knows anything about this shit, God,
Right?
untrue.
So, Johns Hopkins and Harvard and all these, distinguished places are publishing studies that show that it is a medical benefit, and it's in an
Yay.
area where we really need help, and so that's coming, and probably in the next year or two, the first of those will come online, and I think most of the entheogens will be rescheduled to the scheduled drugs, still be tightly controlled, but they'll be available for our use, and it'll be like and I think the pharmaceutical research that's going on right now, is a bit Western based, but it'll give us an idea of what mental health issues work best with which of these entheogens. So that's where I think the real benefit has kind of come from. Someone who has complex war trauma does best with this medication. Someone who has opioid addiction does best with this. So
Mm,
we'll have more tools in our bag to be able to really dial in the treatments. So I see that kind of becoming more mainstream in the next couple of years. And then people's own spiritual awakening and, spiritual tourism is a booming,
Jesus.
huge
Yeah, it
business.
is.
Hmm.
And the more people that awaken, the more they stir up others to awaken.
Yeah.
And so I just see it growing bigger and bigger.
Hmm.
I would love to manifest a retreat center for my ketamine patients. It's hard because they come in, they get a treatment, and then they got to go back to their screaming 3-year-old or their
Yeah.
idiot,
Yeah.
whatever it is. So I would love to have a place where they could come for 9 or 10 days to
Hmm.
do a series of ketamine infusions, to breath work and meditation and group therapy and nature walks and eat organic foods and really dive in deeply to their healing. And so that's that's on my wish list and my things I want to manifest. So
Well,
I think
based
we're
on what I've seen of you, this will not be a wish list, sir. This will be a reality sooner rather than later. Sign me up.
I didn't win the
Hmm.
Powerball on Wednesday, so I got a plan B.
Ah, I love it. I feel like it's like this is a shitty parallel, but I feel like it's like such a like leading edge thing at this point still that it's like I feel like you're like on the one of the
On the
early
forefront.
buy-ins on like Bitcoin or something right now. You know what I mean? Where it's just like,
Yeah,
yeah, you're because you're in so early, like you're gonna be able to expand this as it grows, the scalability for yourself and including other substances as they become more
Yeah.
accepted. Like it's gonna just be something you're capable of doing, I think.
I've always been on the tip of the spear. And
Mhm.
I'm an Aquarius. Also, I'm an Aquarius, and so
Ah,
I'm out
okay.
there doing my own thing.
There it is. Aquarius rising. So totally feel you. Yes. Honestly, I was into this shit in high school. Like before I was like on like maps. You know, maps, like I forget what
Yeah.
they're actually the acronym stands for now, but I was like reading that shit for fun in high school. Like, I don't know, I was always into this. I bought ayahuasca. I bought like the root and like the separate ingredients when I was a freshman in college and like tried to boil the tea in my dorm room. Thank God it didn't work.
You did
Thank
never told
God.
you and never disclosed that story.
Dude, like, no, thank God it didn't work. I mean, I knew what I was getting
Seriously.
into. I was prepped for it, but I would want a guide
It's
there.
delivered to your dorm, you're
It was
boiling
like,
roots.
I
You're
was
like,
like,
hey, bud.
yeah, I was on like weird websites. I waited until like in a weekend when my roommate was gone so I could just do it by myself. it didn't work. I didn't have something that you needed to have. I don't
You had
fucking
the
know.
runs, is what you had.
No, no, not even. It was just like bad tea. Like, I don't
Just
know. I don't know.
terrible.
It was probably all fake too. I have no fucking idea, man. But I since high school, I've been like dying to do ayahuasca, but I always respected ayahuasca as like that thing that like she calls you, you know. And I've had a couple little
Mhm.
knocks at the door of like people like facilitating it basically, and I'm like, I don't know if I can right now. I don't know if I should right. I don't know. And I'm just like, I need to now.
We're
I'm
going
definitely at
next
that
year.
space. Yeah,
We're
dude.
we're
Like
we're
I kind
going
of
with
want to
Dr.
before
Dan.
next year. I really need to like ASAP. But I will say, like, I think my biggest thing for people is the integration of anything right now. I really do think that because like that's where I see people just like struggle the most. You have these great experiences. I have a friend who just went on a retreat, an ayahuasca retreat even. And you get your couple days afterwards after your last like experience to be there and talk with people and whatever. But she's for months after had like a really difficult integration experience coming home. Do you prep people in advance for some of this stuff to like know that there's an integration period that needs to happen and be taken seriously and that can be hard on people sometimes?
Yeah. And, you know, it's so important to have a good guide when you're doing any of these plant medicines. You need to have someone that's got a ton of experience, someone that's has an integration plan, someone that has the knowledge and the lineage and things to do it in the right way. Because there's so many charlatans out there in this world,
Hmm.
Mm-hmm.
plant medicine. So I think first of all, selecting the right place and the right shaman, for the plant medicines. And then for ketamine, our the biggest thing is we want to, and this is the reason why I think precision dosing is really important and our dosing schedule is really important because you don't want to traumatize somebody with an experience,
Mm,
right? If it's too intense or it's too dark or they get in a K, you give them too much and they go in a K hole and they're like, what the hell just happened? And then
yeah.
you're re-traumatized. You got a new trauma you got to
Good
work on,
point.
right?
Good point.
Yeah.
So it's very important that we do this in a way that we
God,
don't
there is
further.
nothing worse than when you have taken something too much. And that's like in the beginning when I talked about, the dancer on stage and she was frozen. I mean, to do ketamine in front of a crew and then to be expected to take your clothes off. I mean, end up that would be a terror. That's like the dream where you think you go to school and you realize you have no clothes on, except it's real life and you're
Yeah.
stuck in a running man position, like your body can't move. That
Yeah,
is, yeah, that all of that would be awful. My
So
God.
yeah, I can't imagine doing it recreational. I know people that do that, but I
it
really
was
haven't.
fun. It was fun. It was a good time. But no, it was actually like really bizarre. It really was. It was just bizarre. I don't know. I don't recommend it either. I don't recommend it to anybody. I tell my crazy stories. I don't recommend it to anybody. Um, but I don't really. I just don't think many people are like me in this way. But not that I'm anything special. But
Shut
I
up.
think
Yes, you are.
what I'm hearing is no, I just mean like I am like weirdly have some weird guiding factor with my drug use of like I never have had a bad experience. I always have good ones. Um, but I'm hearing from your point of view that like integration with ketamine is great, actually, or better, less risky because of the precision dosing. So it's like an ease into the integration, whereas something like ayahuasca can be this like high risk, high reward thing where you get like
Hmm.
this mass blow to your consciousness, and then you come home and it's probably like a lot more difficult. Whereas it seems like you're easing people in, right?
Yeah, it's much ketamine is much more gentle
Like
than
microdosing shrooms almost. I feel like a lot of people are doing that now.
yeah. I mean,
Okay.
but in the ketamine journey, you have full experience.
Yeah, yeah, it's
It's
bigger for sure.
Yeah.
but
Interesting.
Well, I'd love to have you back like in a year, like just do like touch ups to be, or let's see, like, where this has grown, where your practice is at, what you've experienced. I mean, if you're open to it, because this has been so cool and so informative. But
but
like
Hmm.
like I said right before I popped on, I was like, I actually don't know anything about ketamine, not
Yeah, so
one
many people
thing.
don't. So because I think everybody's just hearing about like psilocybin, like shrooms, and like that's always been in the news. But this is there are definitely people who don't even know what this word is. So I'm like very excited
yeah,
about finding this out.
that's one of the reasons I was super excited to come on here is just to get the word out, and people are like, "What are you doing?" uh, and there's so many myths and so many misconceptions about what it is and what it isn't, and there's a lot of fear about around it as well. Some people, you know, have heard the wrong things or are afraid of it, and they're really these experiences people are having are so beautiful, and to be there when they come out of it and to help them debrief and listen to the stories is just it's incredible.
How long does the session last?
60 minutes. It's about an hour.
Okay, okay.
The
Oh,
time,
wow.
the time when you're on the medicine, the time just it could have been 10 days or two
Yeah,
seconds.
yeah.
Time just doesn't
Wow.
exist there. But yeah, they're an hour long each. And then
All
it
right,
takes you
cool,
about a half an hour to 45 minutes to come back around fully, um, to be able to, operate.
cool.
I
Love
mean,
it.
90 minutes to do that, so 90 minutes, 6 times, 3 weeks, and you could be a whole new mother freaking person. And then you got to do some
Hmm.
breath work and spiritual work on the back end. But the things that have been plaguing you and torturing you your whole entire life, or since that trauma arose, can be, I mean, if not knocked out, severely dealt with in 3 weeks. That is the most magically amazing thing. I mean, what?
Why this isn't being screened from the rooftops, I don't know. I mean, I'm doing my
I'm
part.
gonna scream it from the rooftops. I mean, I was already trying to get people to get to you, but I'm getting off this podcast and and I don't do phone calls. I hate talking on the phone, but ring, ring. I'm calling. There are a few people
Hmm.
I'm calling because that is amazing.
Yeah,
And
it
I would
really
say like
is.
there's so many people I know who like want to do like an ayahuasca retreat, but that's just thousands of dollars, man. Like it's not a cheap investment. And you got to go to Peru or something, like if you're trying to do it right, you know? So like this, like I think is an excellent alternative option. If you're very serious about trying to heal something, I think go try and look into ketamine around you and explore that
But
option.
with
Like
that,
it's
so
available
but
now.
with a solid person, not a
Right.
gynecologist, someone who
Right.
has gone to the Tampa Center, who has done the work, your dentist, if that because that's what happened with Botox and all these things back in the day. I remember going to my oral surgeon and he was like, "Oh, by the way, I do this," and I was like, "No offense, but absolutely not." Not, no, you don't know what you're doing. And your eyebrows 35 inches higher than it needs to be. Like you probably practice it on yourself. You need to practice some more. So make sure that you're going to a reputable person.
Yeah. Yeah, read the reviews, listen to people, get some references. It's because it is important. It's not equal across the board. So, um, and we're seeing new patients. People if they want to call and learn more about it. My nurse
Yes.
Taylor is wonderful. Doesn't doing discovery calls, doesn't cost
Well,
anything.
what's your business? Yeah. So what's the name of your business? How do
Hmm.
people find you? Instagram, like drop everything
But I'll
so people know.
Dr. underscore Dan Ripley underscore Ripley is my Instagram. Coastal Ketamine is our business Instagram. And we're over in Mount Pleasant in Seaside Farms next to Pizza Mia and Target, if you know those.
Yeah.
um, yeah, we're seeing new patients. I'm a veteran myself. I was in the Navy. I went to Operation Rocky Freedom and saw what those guys went through firsthand. And so we treat a couple veterans, 3 or 4 veterans a year for free. Um,
That's
so
amazing.
somebody that's a veteran that's really struggling but maybe can't afford it,
Hmm.
we pay for it for them. So and our veterans all get 10% off board. So yeah, that's where we're at, and we're seeing new patients, and we're happy to talk with anybody who's just wants to know more.
Well, thank you for your service. Thank you for your time. Thank you
Hmm.
for what you're doing for our community. I am so excited to see what else you do, how this grows. I mean,
Hmm.
this has been one of my favorites. So thank you.
Yay.
Thank you
So
for having me, and God bless you guys for doing the work that you do. And I just love this podcast, and I love that you guys are authentic and raw, and just you know when you do that, you encourage others to do the same. And the more people we have living in authenticity, the better this planet's going to be, I believe. So
Absolutely.
you're welcome.
Absolutely.
agree. I love it. And thank you, listeners, for being here. Please review 5 stars, do the thing. It helps the
Like,
podcast
subscribe,
grow. And we're
share, follow
growing.
us. Yeah, we
We
are.
are growing. We are growing. It's looking good. Oh my God. And we're about to hit our 1 year. I know we've said this, but like, dang, this is really coming
Um,
out like right around that 1 year. So
yeah.
dang, I think our next recording will be a 1 year episode. So we got to talk about that. Anyway,
hmm
very much looking forward to this. I will hope to meet you in person next time I'm in Charleston.
Absolutely.
Hopefully sooner rather than later. Very much potentially sooner rather than later. Who knows? All right, everybody. Thank you for being here. Until next week.
Thanks, Dr. Dan.
Thank you guys.